welcome to everyone. My name is Michael Fine. I'm a writer and community organizer, a family doctor and a public health guy, and president and board chair of Primary Care for All Americans. I can't tell you how thrilled we are that you've joined us tonight. As we build this movement and this healthcare system that's for people, not for profit, and starts by providing primary care to everyone in every American neighborhood and community. Man, are we rocking now. We have people from 40 states. We've got five work groups involving more than 40 people who are helping us build this movement. We've got four state work groups working on figuring it out state by state. Our main challenge now is to get people excited and bring in hundreds more people. And we need you to help us think out exactly how we're going to turn on that heat. We've built the bonfire now. Now we need the match. So please go into your work groups and think out of the box. No idea is too outrageous. This needs to be a diverse movement of young people. And we want to hear from you. We want to hear your ideas of getting those people here and getting them active and involved so that we're each bringing in a couple of new people every single 2 weeks. Thanks to all of you who have already volunteered to help. Remember, we need everyone. So please volunteer to help if you haven't already. And please, please, please bring others. It's now my great pleasure to introduce our moderator for this evening, Donna Smalls, and to thank the Zoom Committee of Primary Care for All Americans, which organized this Zoom, to thank all the work group facilitators, all the coordinators, communicators, and logistics folks, and to thank John Wright, Brian Kaiser, and Patty Armstrong, our ACE Zoom producers. Take it away, Donna.
Thank you. Hi, everyone. Thank you all for coming tonight. Being here makes you part of building this movement as we break this stranglehold to provide healthcare for people, not for profit, in every neighborhood and community. Primary care for all Americans. If you haven't done so already, please put your name of the community or state that you live in the chat and add 2 first names of people you would think who'd be interested in joining us for the next Zoom who haven't come yet, so everyone understands the opportunities we do have here together. Remember, we are building on our new policy on culture, tolerance, and respect, so no professional titles, please. Now I'd like to introduce our newest board member, Hannah Hamdi. Hannah, can you tell us a little bit about yourself, your journey through healthcare, and your thoughts about primary care for all Americans?
Hi, yeah, I'd love to briefly talk about why I am here and how I am really excited to be a part of this work. So I think what's really cool about my background and that I hope to share is that I have kind of a personal background, professional background, and like a policy background that kind of intersects with what we're trying to do here. I have a master's of public health and have taught like health policy classes about places similar to what Dr. Fine was talking about earlier, where they have like electronic health records that actually help coordinate care and not like create all these barriers for people. Wow, what a thought. Yeah, so I think that there's a lot we can do to improve primary care for people in America. And practice-wise, I'm a midwifery student right now, and I want to provide like primary reproductive and maternal care for people. It kills me to hear that there's a erythromycin shortage. Like people put that on the baby's eyes all the time, and now it's like, oh, that might not be there either. But I've heard also of a lot of like insulin shortages, penicillin shortages at times, and it's really unfortunate that that continues to happen. I want to briefly just say one personal story about my life and why this is important to me is that when I was young, before the Affordable Care Act happened, my mom had just divorced my father and was now a single mother and didn't have health care, so we were uninsured. And something really sweet that our primary care physician did for us, my pediatrician, he knew my grandma and they're both Palestinian, so they were like homies, and he would just like see us without letting us pay. Like he wouldn't send our like charts to billing. He would just be like, okay, you come now, it's your turn. And he would just see us and like fill out my physicals for whatever sports activities I wanted to do. And that really like And my mom noticed, and she was like, look, he cares so much about his patients, and he's willing to see us without accepting money for it, you know, because like what he cared about was providing care for people. And I think that's what energizes a lot of the people here and what energizes me as well. So thank you.
Thank you so much. That was actually a wonderful story. Thank you for sharing, and we're so happy to have you here with us. Now let's focus on the work in front of us. Let's work together tonight to find the magic words we need to open the floodgates so 100,000 people will join us from every neighborhood and community across this great nation. Instead of a main speaker tonight, we're going to go into our breakout rooms to give you a chance to talk to each other, to the members of our steering committee and board, or to gather with others in your work group to focus on the task at hand. Is everyone ready to get to work? Groups will have around 30 minutes to talk and work together. Afterwards, we will come back to hear from each group. We're not going to want to miss this. We'll want to hear what everybody's doing. Before you make your selection, we have asked each team leader to share a quick description about what their team is working on. Aaliyah, can you please introduce our team leaders and work groups?
Of course. Thank you, Donna. So our first work group is Playbook and Resource Guide. Our team leader for that will be Margaret. Margaret, please tell us a little bit about your team and what you guys are working on.
Hi, Margaret Grady here, joining you from Baltimore, Washington International Airport. I'm afraid it's a little noisy, but I'll do my best. So the state Playbook and Resource Guide work group is working on providing, creating a resource that state work groups can use in order to do their work. We know that some of the most impactful policy is formed at the state level, particularly around Medicaid and certainly around workforce as well. So we're trying to create a guide that will help provide, recognizing that each state is different and has different needs, provide some continuity and guidance for how the state working groups should do their work. Tonight we're meeting with the state working groups. I know Rhode Island is going to be there and we'll be doing a presentation about the work that they're doing. And that's really important because we really need the feedback from what people are doing on the ground to help inform the playbook. And also it's going to be a live document. As we figure out what works and what doesn't, we want to be able to update the playbook. So please join us and contribute what you can.
Oh, thank you so much. Next, we have our social media group led by Fatima. Please, Fatima, tell us about your team and what you guys are working on.
Hi, good evening. So visibility is viability in this ever shortening attention span currently. So we work on reaching out to people, connecting with people who have the same ideology, and making sure that more people join and we develop this movement.
Of course, sounds amazing. Our third group is the engagement group. I believe either Larry, Jack, or Dr. Fine will be introducing the group.
Jack, you want to do it?
Soon as I am unmuted. Okay, there we go. Yeah. Hi, I'm Jack Bercuto. The engagement group, we're looking at how to best engage and excite people into the process. And so I think the questions tonight are questions like who should be invited and what would excite them to be engaged in the process.
Thank you. And lastly, we have our newcomers group led by Dr. Alan Roth. Dr. Roth, can you tell us a little bit more about the group?
Sure, Alan Roth, one of the board members, and I'm just here to invite anyone who's new to the organization, not sure what they want to do with us, just to have a discussion of how we could get folks involved in a way they want to be involved to help us change the healthcare system. Thank you.
Awesome. All right, guys, make sure you turn on your cameras, please. We're building a community. And it's kind of tough not seeing all those amazing faces of yours. At the end, we'll have each team leader record the session and we'll have all the information that you guys discuss in each session. Patty?
Yeah, of course. We are super glad to have you guys joining. Lynn, did you have a question before we send people into their work groups?
Sorry, I guess I thought we were also going to do a state work group. Are we not?
So
No.
that is a great point to connect in with. So we are asking everyone who joined a state work group before for this session to join the playbook and resource
Okay.
guide team
Okay.
so that you guys can sort of work on those really high overarching things together. So thank you for bringing that up, because I think that was a point of clarification that we wanted to make as well. If you guys are ready, we're going to have John activate our workrooms. As you will see.
Great. So let's do the who question first. Who will it be important for us to invite into the process, into the movement? And then after the who question, let's get into the what, which is it's actually the why, also why question, which is what would excite people, what would get them energized, what would make them feel excited to be a part of the process, right? And now, and that's the second question, what would excite people? And notice the emphasis on excite as opposed to what would depress people or make people anxious and despairing enough to join us. Okay, it's a very different question. It's not the question of how does it suck to be us. It's a question of how excited can we be to be us. That's question number 2. So question number 1, welcome Fred. Looks like Fred's here. Michael, looks like you might be here also. Welcome. Who is it important that we invite into this process? And Michael, will you remind me, we're talking about local and state level or local level primarily?
I think anybody and everybody.
Okay.
We really want to make sure that local work groups get started, but we're aware that not everybody will be will live in a place where there are 6, 8, 10 other people close by to work on something locally, so they might want to participate on the state level. And there's so much work to be done, so many opportunities to really make a difference that we really need every single person.
Okay, great. So let's just brainstorm, and you can say things out loud. You can, we're small enough, we don't have to raise hands probably. We're not 80 people. Or you could put it in the chat also. The chat gets saved as well. And everything gets recorded. So what comes to mind? What are the first people that come to mind? Who should be invited into this process?
We could almost put it into a spreadsheet format with columns and lines, because you've got kind of you've got provider groups, right? But you've got all of the different types of providers. You've got FQHCs, sole practitioners.
Jargon. What's that?
Oh, yeah, federally qualified health centers, FQHCs.
Thank you.
Then you have, I'm going to use another one, DPCs, right? Direct primary care docs that are basically setting up a practice and trying to reach a critical level of patients so that they can financially maintain a practice, but practice along the lines of value-based care with fewer visits and all of that. And then you have worksite clinics or shared clinical health centers. That's kind of a third category. And then you have hospital-owned primary care. And you have concierge medicine, and concierge is taking on that high dollar, executive level. And those are all similar but different. And they should all be represented, I think, from a provider perspective. And then, I think you also have to have not just looking at the physicians that are staffing those, but others who are providing care, at all levels. So practitioners, RNs, nurse assistants, and then patients, advocates, employers. These are all the who's, that need to be here. To get primary care to all Americans, you're going to have to fill in the boxes for all of those different subsets.
Great. Excellent. Yeah, thanks.
I had a sort of a definition kind of thing. When you're talking about local groups, you seem to be talking about geography, but maybe we need to use a different word than local and have, because if you want work groups and want people tackling certain things, you don't need to be local anymore physically. I mean, that is a good point. If you want a neighborhood clinic, you would want that, a local group to work on that. But if you have issues that need to be addressed, you could have some of these various patient subsets or professional subsets working, and they would be, I don't know what you would call it, sort of, I don't know, I'm not good with words, but some kind of other kind of local, people with something in common. I'm sure there's some fancy word for a group like that when people make all these box diagrams.
Affinity groups, is that what you're?
Yeah, that's an idea. That's a good word for it. Yeah, because I'm older and I had specific needs, and I had a terrible time finding a primary care practitioner. And we really need people working on, unfortunately, the society tries to not discriminate against the elderly, but they're so clueless. They trample right over you without even noticing they did it. So we need groups just for that, or we need single mom groups, because there are very specific needs that people have. And the people trying to run a decent healthcare practice, which you mentioned, definitely needs a lot of support right now. I just finally found the primary care group, women's medicine, whatever, and I had a great nurse practitioner, one visit, and their collective suddenly had to join another collective, and some of the people I was referred to are immediately gone. My nurse practitioner is immediately gone. I have a new one who also seems really good, thank goodness, but they still haven't got anybody to refer me to for something else. I mean, they're going to out-refer me, but they don't know that before they had people in their group, they knew. And so it takes longer. And
Okay.
I was told by somebody that now this is like a thing that you were talking about, primary care docs who want to set up like a practice, sort of, that you can't do that really by yourself anymore. The insurance won't cooperate with you.
You can. That's
But it's a fight.
and there's a resurgence of that through direct primary care, and a lot of people in the there's a resurgence of a kind of a revolution among healthcare payers, and they're great targets for this group because they want to stir the pot and they want to change the payment model, especially for primary care. So there are individuals out there in pockets of the country that have assembled community-based health plans around the sole practitioner, and the goal is to help that doctor, that physician, or that physician's office that's independent achieve a critical mass so that they can be financially viable but still provide high value healthcare. And that target level seems to be around 600 patients in their group practice per physician.
My chiropractor is working by herself right now and trying to do her own billing. I would love for her to join this group, but I finally had to ask her how much I owed her because she hadn't billed me in so long. And so I think she's a little swamped. And it's because of this ridiculous stuff. And she has to fight with everybody to, and being a chiropractor, they don't like you half the time anyway, even though she prevents more medical bills than they know. So I have to remember to poke her again about coming to this. I think she would really like it.
Yeah, that's a great example. We're growing a really, if you haven't peeked into the chat recently, there's also more personas, more types of people who mean, we might want to make sure we invite. Let's add to the who list before we go to the what list. Any other who's?
My only other who is everybody. I mean, we need small business people. We need, people who aren't medical at all, and Eliana, to answer something you got at, Primary Care for All Americans kind of believes that this is a moment for communities to take back control of primary care and provide it for ourselves in the way we provide police and fire protection for ourselves, in the way we provide our local schools for ourselves. And so it's that group of people that we're trying to figure out how to get that group of people together so that people in communities run this. And we don't have to rely on big hospital systems or state governments. Communities do it themselves, sort of provide care them by themselves with folks that are of the community.
Yeah, in Cleveland where I'm at, that's a good point, Michael. In Cleveland where I'm at, the only gains that we've seen in education is when, to your point, Michael, when the community has taken over education. So
I am
yeah.
so excited
Go ahead.
about your community. I have been messaging for probably 2 years now on LinkedIn. I founded a group called the Interprofessional Primary Care Institute, and I've been messaging the idea of schools, public schools, as our model for how we do this, and then adding to that we need private and we need public partnership at the neighborhood level. So I've done quite a bit of thinking about this for some time. And what has occurred to me recently, because I started getting involved in chambers of commerce in cities, small towns, is that the Chamber of Commerce, and I've started with this one small community that I'm very much engaged with for many years, and just started talking about the work that I do in advancing interprofessional primary care teams. And it's occurred to me that they don't, the people in the Chamber of Commerce are not familiar at all with healthcare. None of them are healthcare workers. In fact, I don't think a single one is a healthcare worker, but they're very interested. When you start talking about primary care, they're like, well, I can't, there's problems with primary care. You can't get access to primary care. And they're the business leaders within local communities. So anyways, I don't know if that helps at all, but it seems to me that within towns and cities, there's these chambers of commerce and there's city governments that I would never, I'm a psychologist, I work in primary care, but I'm a psychologist, and in federally qualified health centers mostly, but other places too. But never would have thought about Chamber of Commerce as a place to advance primary care progress, but it's seeming that that's a place that could be useful.
That's a
Mhm.
great
I don't know
idea.
if people have done that.
Yeah, Chamber of Commerce could sponsor a shared health center clinic on a capitated basis. And, that could be a benefit of membership to the Chamber of Commerce because they essentially would control, the clinic, right? So.
Well, what I was really thinking of is that the businesses would say, we don't have access in our community to primary care. What can we do in partnership with public? Because Oregon also is very good with primary care from a public standpoint. Our Medicaid is excellent. We have a primary care office in our state government. So our positioning to be able to engage both the private sector and the public sector in partnership around creating high quality primary care that is run by the local neighborhood leaders, local city leaders, like that's actually possible. It's not, I mean, there's a possibility for excitement around that. And that would be, I don't know, I followed a little bit. I didn't know about this community until about 2 months ago. And then I started reading on the Rhode Island stuff and very similar ideas that we have in our community with our institute. So very excited to see some but that would be completely new from my perspective. I've worked in primary care sector for a very long time at this point, to have a city take the primary care access and partnerships through grants and private investment. That would be a completely different model from my perspective, and that could potentially fund all the great clinical models we've been trying to move forward for years, of which can't move forward because of the fee-for-service way in which we pay for things.
That's really great. I want to shift because of time to the what would excite people. We have a great list. If you have more people that'll come to mind while you're walking the dog or walking your cat later this week, whatever your lifestyle is, they should people should send those to, where do they send their, because we don't have a shared doc yet. I didn't mean by doc, I didn't mean like a primary care doc, but we but that's a good idea. We don't have shared documents yet, but where would people send other ideas, Michael?
If they just want to send them to me, I'll put my email address in the chat.
Okay, great. Thanks. Because you'll have more ideas. What I love about what we came up with so far quickly was that we could send this list, which is not short, to any community. And so I think in some communities create a wow factor of like, oh my God, we've got all these people here. We've just never actually joined them together in a conversation to move things forward. Most communities in the country, in the US here, have never had a serious adult conversation about how the community can take ownership of primary care. Right. And all the people you name, all the cast of characters we just named are the people who become the wow factor of like, oh man, we've got those people. I wonder if we could invite some of them into the process. So this is a really excellent product. The what question is what would excite people? So let me put a real clear frame around it. Okay. These people need to get invitations, like actual invitations, right? Through some media saying, please join us. And the join us is, and then the join us is the reference to what do we want them to be excited about? Okay. And we've got a whole playbook group. So we've got, and I took a little peek at the playbook, and it's really pretty massive. There's a lot of things that they're plotting and planning and conspiring about. I'll put it that way in an all positive sense. But just from our perspective, what would and I really want to hear. I want to hear from everybody, but especially if you haven't had a chance to get in the conversation tonight yet. Again, you could chat or talk out loud. What would excite people? What are some things that when they look at the invitation, they're saying, oh, I can't miss that. No. I have to be at this is where it is. These people are out of their minds. This is something that I can't believe is happening, right? That's what excitement sounds like, right? I can't believe this is happening. I have to join this. So what would excite people?
What if we had community health centers become a greater part of the state infrastructure, in the sense that the community health center is a pilot project for what we'd like to do on a state level? And if we can just
5 minutes remain in the breakout rooms.
And if we could somehow garner some kind of communication with state government at a number of levels, we can either have projects that are pilot projects or projects that can actually stand on their own to supplement what has been done already. The community health centers are in some way a start. Why can't we take it and get it to be more universal? And then we can figure out if we all believe at the state level, at the governmental level, at the political level, that it's doable, then we can start to plan what the system would look like, where the doctors would be. Because I think what we're looking at is trying to do something rather radical in a relatively short period of time, if we can.
The only thing I would say about that is that the audience of a community health center is going to be really the uninsured and the most needy, but that's Yeah, and that's representative that's of some, but not everyone. And you have to have what's going to attract employers from a cost perspective, or from a population health improvement perspective. So the things that are going to, what are we doing to help people learn how to, embrace wellness? I mean, really embrace wellness.
Well, wouldn't the
And
Medicaid system anticipate that there'd be cost savings from this? Couldn't we talk to those folks and say, look, if we take this approach, as Michael has written in his books, that if we take that kind of an approach, that we will eventually save money, and governmental officials, at least they'll listen to that. I'm
yeah,
sure you've
but
all done it. I'm a newcomer, so I'm
your
probably just
your
retreading.
employers, though, are not going to embrace federally qualified health centers from for their particular population. It's hard enough to get employers to share a worksite health center. So they're, I'm sorry.
Are we even sure we know what everybody wants? I mean, we have a general
Well,
idea. So what if
everybody
we
wants
just said,
different things, and
right, so
that's the
what if
whole
we
point.
said as a come on, we want to build a new approach to healthcare, or somehow like not even like try to talk about fixing what's there, but figure out we're just setting up a new approach, a new step aside. I don't know. We have to make up an excuse for how it's going to exist
Right,
separate.
without sounding too many alarms, we have to have a new approach.
Right. But the thing is, what we want to ask people is if a new healthcare center was going to be set up in your community, what is your dream access to healthcare? If you could have it the way you wanted, the single mom saying, I can call up in the morning and say, Junior's got a stuffed up head. Can I bring him in right now? Or if you're a senior citizen, they won't freak out if you say, it's all ice out there, I'm not going out. Or, whatever it is that people could say, or I want to get pats on the back for coming in more, as opposed to like, oh, you again. It's like, but like somehow ask people what would be your dream way to have access to help. Just make it like they're really gonna like get to ask for, because everybody's frustrated. They're gonna get to actually ask for, we're designing a system. How would you like it to be? Because nobody ever asks. They just stand in line over there.
Yeah, that's important.
I need to go to the bathroom. Something's wrong. No, just stand in line over there.
Yeah. Well, what you're saying is, what's important about what you're saying is that people want to come to something that's new. They want a new conversation. If you say, my God, we're going to have the same old conversation again, be excited and come, you're not, it's impossible. Well, you'll get a lot of cranky people who really don't want to do anything, right? People who are against action. So yeah, we've got about maybe half a minute. Anything else? What would excite people? Obviously, the dream conversation would do that too. Anything else that would excite people?
Different things are going to excite different people,
Fine.
so you
That's
have to
fine.
reach them where they are.
We're
Yeah.
looking for ideas about not just what would excite people, but what would excite people to come and be part of primary care for all Americans and help us build this movement. So
Yeah,
it's a
'cause
kind of two-step process. First,
Yeah.
we have to get people excited and committed to build this movement, and then we can go out and have community by community conversations.
If everybody who's interested in primary care, yeah, if you could find something that every single one of them, of those groups, like that everybody is going to contribute from wherever they stand. I think that for me, like wherever you stand, if you're interested in primary care, wherever you stand on how to fix it, if you can find something where every one of those groups are contributing, that could be powerful.
Excellent.
Like not just one group who thinks about primary care, but all groups who think about primary care, all the groups who think about primary care, if all of them were contributing to building a new kind of primary care, that would be powerful.
Yeah. Well, that's a theme here of what I'm hearing is that it may not be one thing that excites everyone, but it might be 19 things that excites 19 different people. I think that's what we're coming up with.
Absolutely.
That's great. Thank you so much.
Here. All right, so we have hopefully had some great discussions for groups, and we want to keep this fairly brief for feedback. Aaliyah, can we have you go back around the room and ask the groups what they did?
Yeah, sure. I hope everybody's breakout rooms were, informative and productive. First, we'll have the Playbook Resource Guide team. Margaret, can you let us know what you guys talked about?
I think Wayne is going to give the roundup.
Sure.
Okay, we had a very vigorous discussion in our time, and we started off by talking about two interesting bills happening in Rhode Island, one around tuition reimbursement and another one around providing state funds to incentivize primary care practices to host medical students, NP students, and PA students. Then we kind of talked bigger picture about a game plan and a toolbox. We talked about how a game plan has to be customized to the idiosyncrasies of each individual state environment, and that we ought to create kind of an overarching list of audacious goals around primary care, such as doubling primary care investment, shifting from fee for service, et cetera. And then we ought to provide resources, PowerPoint slides and bibliographies and annotated bibliographies, a collection and collation of different media that happens on a weekly, monthly basis, where something is podcast or a publication or a media that people have a summary with video clips that are already embedded in PowerPoint, like super spoon feeding, so that people have access to these resources and can just go ahead and grab up what they need for their own state. And we finished with the concept of leveraging different state organizations, such as state chapters of the American Academy of Family Physicians, state chapters of nurse practitioners, physician assistants, and other state chapters, and to try and come together and collaborate. Because if we can speak with one voice, instead of hundreds of silos fighting the same ridiculousness in healthcare, if we can come together and speak with one voice, that one voice can be much more powerful.
Wow. Sounds like you guys got a lot done within that 30 minutes. Thank you, Wayne. Next, we'll have the social media team. Fatima, can you let us know what you guys talked about and your next steps?
So we are actually jumping over to me for this one. We had a little bit of technical difficulty. So I love hearing what the Playbook and Resource Guide team is working on, because we're going to take all of that content from you guys and utilize it in our social media teamwork. So thank you for spoon feeding us the information we need. You can't share what you don't know. And so really tonight, our call to action to the rest of this group is to be informed. And there's two ways that you can do that right now. One is you can go onto social media and follow us. We do have a Facebook page. We do have a LinkedIn page. Pick one of them tonight and go and follow it. We're still building content, but go on, get connected. And as content continues to flow, that will definitely help us, because then it's just one click to share. The other thing is, if you get the newsletter right now, give me a thumbs up. Go into your, all right, we're getting newsletters out to the world. They are produced by the wonderful Brian Kaiser, who is not in here, so we will sing his praises this evening. He is doing an excellent job of getting us information. That is a great resource. When Michael says invite 1 or 2 or 35 people, forward that newsletter on to that one person that you maybe dropped in the chat earlier. People cannot connect to what they do not know, and you need to know so that you can connect others to it. So really encourage you, first, follow us on social. Second, take that newsletter and use it as a tool sometime in this next week and forward it to one person. Find an old one, say, hey, I thought of you when I read this. Here we go. Thanks.
Thanks, Patty. Yes, we'll all try to spread the word and follow us on Instagram as well. Next, we have the engagement group. Jack, can you let us know what you guys talked about and your next steps, please?
Yeah, boy, I'll tell you, if we had more time, we would have loved to have had next steps. The only next step we have is that as soon as I find out where the shared documents are, I'm going to post our outputs. We looked at two questions: who needs to be invited to the process, and what would excite them? We came up with at least a dozen who should be invited, about a dozen personas or types of people or demographics. Soup to nuts. We did everything there. And then the second question we looked at was, so we had about a dozen. And then the second question was, what would excite them? And we came up with some ideas, but the main point of consensus agreement was around that we need to have as many whys, why to get excited as we do different types of people. Right. So the idea is not to come up with one thing that's going to excite 12 different demographics, but probably 12 things that are going to excite 12 different demographics, because everyone, this is why it's a wicked problem, right? That we have such an immensity of complexity of people who are stakeholders and players in the space. So that's what we did. Lots of people to invite, and a sense of what the invitation architecture should look like. Thank you.
Thank you. Lastly, we have the newcomers work group. Dr. Roth.
So we actually had a very lively discussion. We had an array of folks on the call, from academic physicians to former president of the AAFP, to Hannah, one of our new board members, to a direct primary care physician. So we kind of got the entire mix of how the delivery system is either working or not working. We heard our former AFP president talk a little bit about, in an interesting way, how there's 4 different payment models, from fee to service to salaried physicians to capitated models to pay per performance models, and how each model affects patient care, maybe not in a good way, depending upon how you're delivering it. So it can be in a good way in certain ways, but I think it opened up a lot of room for discussion, for our board and the direction and some of the things that we want to accomplish. So I think it was lively. I hope that some people who were just lurking want to join us and spend a more active role in the organization, because it can't just be us. It needs to be a team effort, and we need everyone's input to kind of make this happen. So that's kind of what we talked about.
Awesome. Well, thank you, everyone. I mean, everything you're doing in your work groups sound very productive. I'm definitely excited to see where PC4AA takes us. Donna, are you excited?
Yeah, I am. It was very nice to hear what everybody was doing during our work groups. Now, we want to thank everybody for coming, but we also want to encourage everyone to bring someone new to our next Zoom on June 11th, when we will be hearing from the health policy scholars at UCSF in San Francisco. They're going to be talking about their playbook to bringing primary care to everyone in California. So register on our website at www.primarycareforallamericans.org. And while you're there, go ahead and click volunteer in the contact us section of the website to tell us how you would like to be an active part of this movement. And then also, if you're so willing, so please click donate to support our work together with a contribution. Really, every little bit does help. Once again, we need and we appreciate every single one of you for helping us spread our word and our movement across the nation, so we together can get the change we need and that you so deserve. Join us again in 2 weeks on June 11th. Bring one person each time. Better yet, bring 2 or 3 or 4. Healthcare for people, not for profit. Primary care for all Americans.
So please take a minute to complete our survey. I just dropped the link in the chat a minute ago. We want to hear from you. We want this to be something that you can be proud of bringing people to and that you want to engage with. There is a comment section there. It takes about 2 minutes to complete. There's also links for our LinkedIn and Facebook page that you can follow as well.
Yes,
Thanks.
thank you again, everybody. Thank you. I hope you enjoyed the discussions we had tonight. We can't wait to see you on June 11th. Thank you.